I will be chatting today with Adrienne Chhouey. She is a colon hydrotherapist and Bio-Electric Lymphatic Drainage Therapist. And those treatments are so important. Colon hydrotherapy is to cleanse your colon, and Bio-Electric Lymphatic Drainage Therapy is to drain your lymphatics. And as I always say, those exits are really important to make sure they're working well. But we're also going to be talking about Adrienne's journey through infertility and eventually having a baby, and also leaving her job to join our wellness world. And I really wanted her to share her story today because she has a very unique story, and I think it's one that people would love to hear. So tell us a little bit about yourself, Adrienne.
It was around the time that my husband and I, Savate, were trying to conceive, and we had hit a roadblock. And my conventional OB had told us that, everything looked normal according to their standards, and that, I should entertain the route of going down the road of seeing a fertility specialist and doing fertility treatments. And medically, I had done the basic testing. There was no medical reason that I shouldn't have been able to get pregnant. And so as soon as they kind of said, you need to do fertility treatments, the red flag went up for me. For whatever reason, I've sort of just always had an aversion to just jumping into medical procedures or taking pharmaceutical medications. And so I thought there's got to be another way. And that's when a mutual friend of ours had suggested that I come see you, because she had told me that's what your specialty is. And so I think we had chatted over the phone or text or something, and you said, just come into the office, let's talk. And of course, that's when you said, I think I can help you. And that just began the journey of what I hadn't foreseen would be the biggest transformation of my life. Mm-hmm. And so where we started, clearly I started seeing you for fertility, but I think what we uncovered was just so many other issues and dysfunction that was occurring in my body. But when I had started with you, I don't know why I didn't think that all of those things would, of course, be affecting my fertility, mm-hmm. but I was having a lot of anxiety, panic attacks, just migraines all the time. I was constantly exhausted, no matter what I did, in every sense of the form. And then through some of the testing I did with you, I think we uncovered some digestive and gut issues, and just a lot of toxicity in the body. And so that's really where we began our road in starting to bring balance and harmony back into the body. One of the other big things that I had to take stock and inventory of my life was what was just going on personally and professionally. There was just a tremendous amount of stress in my life at that time. I was working in finance and just doing the grind, I think, as everybody does. And it's not so much just that there was a source of stress in my life. I think there was also this really big factor of me not being in alignment with my truth and doing the type of work that just fueled my passion in my heart. Mm-hmm. And so, with all of that combined, there were some other things going on. I had nearly lost my dad and my grandma, within a short time. My dad was hospitalized and my grandma did end up passing. And it was all at the same time that all of this stuff was going on at work. I was dealing with the infertility as well as some other issues at home. And it just all came to this big mount of pressure on me. Mm-hmm. And when I think it was during a visit with you, you had broken down a chart for me, just showing how stress impacts your cortisol, which mm-hmm. subsequently affects your hormones, and obviously your ability to get pregnant. I don't know why, just all the light bulb went mm-hmm. off. And I think it all came to the point for me where I said, enough is enough. And something's got to change, because not only can I not continue living like this, but I want a baby. Mm-hmm. And I was afraid that if I kept going down the road I was on, not only would I not be able to get pregnant, I might end up getting really sick. Yeah. I mean, I guess even more dysfunction than I was already experiencing. Yeah. And so I quit my job Which, if anybody knows me, quitting the job kind of on the fly with no real plan in place was not something that I would have done. And I call myself a recovering perfectionist. Definitely was a type A. It was just, I had to take this leap of faith because I knew it was worth it. It was what I needed. And not just wanting a baby, but wanting to live a life that really just felt so much better for me was really important. And so I took those 8 months off and I did some soul searching, and I think I pretty much followed all of your recommendations, your treatment plan, which included, not just taking the slew of all of the supplements, but really reevaluating and rebuilding my relationship with food. Changing just a lot of lifestyle habits, engaging in things like regular meditation and yoga, especially hot yoga, just a mindfulness practice of learning how to be more present in each moment really made a big difference as well. I was doing colonics and lymphatic drainage and just the whole gamut of things to really change every aspect and perspective of my health. And so that's kind of what started me on that whole journey.
Yeah, so then you quit your job, took 8 months off, and then I think we had a visit where I said, hey, I'm looking for a colon hydrotherapist and someone to help me with these detox treatments, and I think you would be great for it.
Yeah.
And you just took the ball and ran with it. And now Adrienne is the colon hydrotherapist and lymphatic drainage therapist at my office. And then tell me what happened after that, because you left your job, totally switched tracks, and then what happened?
You are in the midst of building natural start medicine to what it is today, and just that vision of really treating the whole person and giving the opportunity for your patients to address their health from every different perspective. And so you had presented the opportunity to me, and if I'm honest, it wasn't the most glamorous proposition at first, but you, I think, very beautifully and gracefully explained to me how that mind-body connection can actually really help me to achieve what I was looking for, because, and I totally understand now doing what I do. Once we kind of talked about that and made that connection, I think it was that same day I texted you and said, all right, let's do this. How do I get signed up? And within the week, I signed up for the program and then, opened my doors to start seeing clients. And I think a few months in, that was when I found out I was pregnant. Yeah. So it's been an incredible journey. Definitely not a path that I thought I would have gone down, but I think the most beautiful part that I've found is just the synchronicity that happens once you start to follow your intuition and just continue to listen to your heart and open those doors, and it's like one door after the next just keeps opening once you do that.
Yeah. Well, I love your story. I think your story is really inspirational, especially for people who are in the same place as you, which is a lot of people nowadays. And I think the reason so many people are in the same place that you are in is just because our world is so toxic. From a stress point of view, from an environmental point of view, from a food point of view. And essentially, to break it down and make it easy, a baby doesn't want to get created in a system that's very stressed out and under a lot of stress from physical, emotional, etc. So when I work with patients with fertility, it's really about understanding the whole picture. What are all the stressors that are on the system that are causing a burden on the system, affecting the hormones, affecting the organ systems, etc. And so I think your story is so beautiful, because really you were A+ patient. I think that was your type A personality.
Probably.
But everything that I said, you not only did it, but you did it to the extent of what I would want all my patients to do. And I think leaving your job is such a hard thing to do. And for most of my patients, especially in the Silicon Valley, it's something that if they did it, then a lot of their systems would work better. Now, not everyone can do that, but you really, you really took the plunge and had the courage to do that, and I think that's really amazing. And I think at the end of the day, looking at your story and all the, courage you had to leave, and then the sacrifices you made to just kind of really go out on the limb and to a place that you weren't comfortable with, and not really knowing what the outcome would be, and then finding yourself pregnant, And what was that, like a year and a half after we started working together or so?
Yeah, I think so. It's about a year and a half.
Yeah. I think your story is interesting. Is it okay if we talk about Savate and just a little bit about how that kind of went about? Because I feel like, so about a year into it, I'm looking at your system and I'm like, okay, you left your job, your stress levels look great, your hormones look great, your cycle is wonderful, what's going on? And I think this is an important point to make, is that sometimes it's not just the woman. And I think that as women, we take on the burden of that sometimes, and like, why am I not pregnant? What's wrong with my body, etc. And sometimes it's, takes two to tango, and I do need to see the male as well too. And I think the great thing is Savate was like, okay, I'm ready, and he came in, and I think within 2 months or so, it was really fast. And he was great because he was committed to make some changes in his lifestyle, and I think it takes two to tangle. It's two people who are committed to being healthy and really having healthy bodies, so that your systems can say, okay, we're ready to create another human being. And I think it was only about 2 months. And you came to my office and said, Dr. Fong, I think, and I was like screaming at the top of my lungs, because and your journey started even before you met me, and I think a lot of listeners are in the same boat. And so thank you for sharing your story. I think it's really inspirational, and I think that you don't necessarily have to take the huge shift that you did, but I think by making those huge shifts, your system really just kind of shifted from fight or flight to now being more in a parasympathetic, relaxed place, and you're still you still love to get things right, but I feel like the anxiousness behind that is not there anymore, which is really great. I mean, you just overhauled everything.
And I think you bring up a lot of good points, but first of all, thank you for I can't thank you enough for setting me on that path, because it's just been incredible. But you're absolutely right. I mean, when I started with you, my ability to deal with life compared to when challenges come up now, I still face a lot of the same challenges, but my ability to re-guide and redirect and kind of find that peaceful place within myself to handle whatever it is that's coming my way, I'm able to access it a bit easier and a bit smoother than I did before. And
I think just having the knowledge of how much stress affects your system is so important. So you talked about that pathway that I draw, and I draw that for almost every patient that comes into my office, and it's your steroid hormone pathway, which starts at cholesterol, and then on this side it leads to your sex hormones, on this side it leads to your stress hormones. And if you're super stressed out, your body shuts down all these other processes, including making the correct sex hormones. And then your body's saying, okay, I'm in fight or flight mode. I'm running from a bear. I need to survive. And you're just in survival mode. And I think, like you said, it was a light bulb. And it's often a light bulb for patients. It's like, oh, so stress is not just, it's affecting my physical body and my hormones and possibly my ability to not, have a baby. So I think just that knowledge is so powerful. And when I gave you that knowledge, you just... okay, so if that's the case, I'm just going to change everything, and you really did it. So,
And I think, a lot of it, you're probably right, it was due to my personality, but also because I just fell in love with the process of once I started to do these things, and for the first time feeling, I suppose, what was supposed to be normal, but to me felt incredible, and having the knowledge of, oh, this is what normal is supposed to feel like, and not wanting to go backwards, and then realizing again where that stress was coming from and not wanting to reintroduce those things back into my life because it just felt so good to be on the other side of it.
Yeah.
And, you brought up, a really good point too of, I think so many women and so many couples in fertility as women, just for so many different reasons, we take it all on. And there's an incredible amount of shame that goes with it. And so I think with that, it's this notion that, no, it's all on me. I'm the one. I have to do all the work. And it really is an important part, not just for fertility, but for the marriage and for parenthood to be on that same page and have that communication and that teamwork attitude as a couple, especially if you're going to bring and sustain and grow life inside of you and bring this beautiful baby into the world. All of the environment that you create around that is incredibly important, but so underestimated by too many people, I think.
It's true. So, that's the problem for fertility. And then my patients will have babies, and down the line, I'm so stressed out because I'm taking on everything. I'm working, I'm cleaning the house, I'm doing this, I'm doing that.
Yeah.
And I do think we as women take on that burden. And a lot of times my homework for those patients is, okay, you need at least 15 to 30 minutes just by yourself, meditating, doing something that makes you feel good. And I think as mothers, as working mothers, even stay-at-home mothers, we're constantly worrying about other people. And that then becomes a form of stress, which then affects the physical body also. So it just shifts, right? And I think the important thing is how you handle that stress. How do you react to it? And then knowing now that you need that me time, you need that time to kind of recuperate in your process of healing. Hopefully, going forward, you kind of incorporate that into your life. Your journey has been pretty phenomenal, so thank you for sharing that. And so now you are a colon hydrotherapist and Bio-Electric Lymphatic Drainage Therapist. So I want to talk a little bit about that because I always have a lot of patients who are like, what is that? Is it safe? How can it help me? So let's talk about colon hydrotherapy first. Tell us a little bit about that.
Yeah, so colon hydrotherapy is basically just a very gentle way to clean out the colon. What a lot of people underestimate is the importance of just having a bowel movement every day. And I think, admittedly, a lot of people don't, or they're not really flushing out their system completely. And I have a lot of clients say that, well, I go every day, but it doesn't feel complete. And the reason that that's so important is if you think about, we're eating 2 to 3 meals a day, snacking in between, and our body is processing and digesting, absorbing the nutrients we need, and then getting rid of the toxic waste that we don't. And I think, as you talk about with all of your patients, is if we're not getting rid of that toxic waste in our body, what's happening is it just recirculates back into our system, causing all of this dysfunction in our body. And so what the colonics does is I use a FDA regulated device, and it just helps me to administer filtered water very slowly and gently into the colon, and it softens and loosens any of that waste that's stuck in there. And then it stimulates the natural contractions called peristalsis of the colon so that we can evacuate that built up and congested waste and toxins and gas and anything that's just stuck in there. A lot of undigested foods is what I see for a lot of people. Yeah.
Well, people aren't chewing enough. I think people are taking 2 bites and then just swallowing it. So, I think the best way to eat your food is to chew something like 25 chews per bite, which I know is a lot. But even increasing the chews by 10 can be very helpful because then you're going to masticate that food and it'll be easier to digest as it goes down.
Yeah. And, what I try to tell a lot of my clients is chew your liquids and drink your solids.
Yeah.
So, chewing it to the point where it's kind of wet and not so big because, and you brought up a good point too, is taking the time, what a lot of people don't know, taking the time to chew and allowing that saliva to really get in that food and produce those enzymes is already beginning the digestion process by sending the signals to your stomach about how much acid it needs to release to digest whatever's coming down there. So that part of taking our time to chew is important, not just for the digestive process, but also just the mindfulness of slowing down. We live in a society where everything is just so fast-paced, And I think if we just break it down to the simple things like take your time when you eat.
Right. Well, being in a fight or flight mode or a sympathetic mode, or being stressed out when you're eating, like if you're just on the fly eating, you're actually not going to digest your food well. So sometimes my patients with acid reflux, I mean, sometimes the only thing they have to do is sit down, relax, and chew their food. And if they do that, actually the acid reflux goes away. So that's not everybody, but that is in a select few cases. I would say, I think you're just eating too quickly, eating on the fly and not chewing enough. I think the other interesting point you bring up is the fact that we should be having bowel movements every day. And I think that this is something people don't know. I think your doctor, your PCP usually says, okay, well, how often are you having a bowel movement? And if it's every other day, that's still normal in conventional standards. But for us as naturopaths, you're eating every day, you should be expelling every day as well too. Or as you said, those toxins are going to be held on in your system and they're going to recirculate through. So I think that's important, that if you're not having a bowel movement every day, you really should do something about that. And that is change in diet, looking at the microbiome of the gut, possibly getting a colonic to just help loosen some of that stool. And that can sometimes really help too.
I mean, in my own personal experience, when I first started doing colonics myself as a client, I thought I was okay and having regular movements. And then when I actually got my first colonic, and you can see what comes out in this little glass viewing tube, I was just blown away. I mean, I could understand and visualize when you see the toxic stuff that's coming out of you. It kind of, again, was this light bulb of, oh my gosh, no wonder I've been feeling so just cruddy, because you can see the toxins coming out.
So tell me how you feel after a colonic.
So I mean, a lot of people, it varies from client to client, but I have a lot of people just saying that they feel just so empty and so much lighter and energized after, because they're getting rid of all of that toxic waste that's just been stuck in their body. And I'll have a lot of clients say, I can physically feel the difference when I touch my abdomen. I mean, a lot of the people I see have been experiencing, a lot of congestion and constipation and bloating and gas. And when I'm massaging their abdomen, I can actually feel it. It feels like a balloon that's been blown up to its capacity. And after, they're saying, oh my gosh, it just feels like it's gone.
And some people lose like 2 to 3 pounds just in one colonic.
I mean, I tell a lot of clients that admittedly it wasn't the reason I went, but after my first colonic, I was like 5 pounds lighter. I was blown away.
It's amazing. So tell me, most people are afraid to do it. They're afraid because, I mean, it seems like a scary procedure. So tell us about that. Tell us, I mean, it's really, in my opinion, it's only scary to think about. When you're actually going through it, it's not bad at all.
I've had almost every single client say that the experience was so much better than they expected in their head. The anxiety and what they anticipated was just fear of the unknown, really. But I try to address that and mitigate that factor by setting up the environment, first of all. I think it's really important, as we talked about, that mind-body connection. And when we're holding that anxiety and tension in our body, it's hard for us to physically release.
It feels like a spa treatment, actually. And not only do I feel that way, but patients have told me that wasn't that scary, and it honestly felt like I went to a spa.
I've actually had a client tell me that it was the most relaxing part of her day, which is a huge compliment. But throughout the session, it's a series of what I call fills and releases, where water is going in, and then the release is where fecal matter and any waste material is coming out. And during that process, to kind of stimulate the release and really help the client feel at ease and really just working with the body, I do a lot of body work and abdominal massage, which in my personal opinion, and I think most of the clients, they just find to be more effective and also just complementary to really helping the body move things out and working through any discomfort that they may feel, and just again setting the stage for that notion of relax and let it flow and let it go.
I think that's an important point to make, is whenever I get a colonic, I not only feel like I'm expelling physically, but also emotionally too. And if I don't commit to that emotional release, I don't get as much of a physical release.
Yeah.
And so I think it's really great that you call yourself the colonic counselor because when I go into visits with you, I feel like I'm not only getting physical release, but emotional counseling too.
Yeah.
And I really think that's how a really great colon hydrotherapy session should go.
Yeah. And if I'm totally honest, that really is my favorite part of the session as well, or just my favorite part of what I do is being able to share in that vulnerability and just connect with the clients on that deep, intimate level. And, you know, I can't tell you how many people I've had cry on my bed for multiple reasons, but just, you know, everybody just walks around carrying so much weight on their shoulders. And for me, the ability to assist them and releasing that and letting it go is just, it's beyond words.
Yeah. So the other thing that people get worried about, I think people go online and then they search Ask Dr. Google and, you know, they find that, you know, could there be a perforation of the bowel or something like that? Or maybe the colon hydrotherapy is pulling all the good, you know, microbiome out of the system. Tell us about that.
Yeah, sure. So to address, you know, the safety issues, I use what's called a gravity column, which basically just allows a very slow and gentle infusion of water into the colon. So it's using like an internalized equalizing system so that the water is going in at a flow and a rate that's very gentle for the colon. And then I'm also really paying attention to the client's, you know, body cues and comfort and things like that to make sure that we're really just taking it very slowly and gently.
So it's really just a really great enema where that goes a little deeper because of well, you know, the machine helps it to go a little bit deeper, but there isn't necessarily a risk of perforation because you're not increasing the pressure up really high.
Yeah, and even better than an enema because I have more control over the pressure. And, you know, as you mentioned, it does go deeper than an enema. And not only that, because of the ability to fill and release with an enema, you know, it's just one time, one and you're done. With the colonic, it's able to get more and go deeper because we can really go by the client's comfort, only put in a little bit and then allow them to release and then resume that process over and over again. To address your question, or many clients' questions rather, about, you know, the reduction in good flora in the gut, there are a few things I tell them. One is that, you know, our microbiome is constantly changing and we're constantly eating and releasing things that are taking in both good and bad bacteria. So, you know, the importance of also making sure to eat foods in a diet that are rich in prebiotic and probiotic foods to really help that gut flora. And then something, you know, for my clients who are really concerned that I always offer is I do a variety of different implants, and one of them is a probiotic implant, which instead of just water going into the gut, it's the probiotics mixed with the water and it goes directly into the colon. So it's a lot stronger because it's not having to go through the entire digestive system and being broken down that way. And it's just going, again, directly into the gut.
Yeah. So I love to prescribe colon hydrotherapy for several types of cases. So first of all, I think that you can just use it as an overall mechanism of detoxification, you know, maybe once a month or once a quarter or at least once a year, especially if you have any history of having a little bit of constipation. We all go through moments of, you know, we traveled and we didn't have a bowel movement for 3 days and then you're holding on to this stool. So I think for everyone, I think colon hydrotherapy can be very helpful, especially if you had a history of constipation. I think I don't think the colonic is going to fix the constipation. The constipation is something we have to work on from a lifestyle, diet, microbiome point of view. But if you have constipation, you can use it as a tool to clean up that old stool and get the colon nice and clean. So we're kind of ready for what we're going to do in terms of healing the gut lining and replenishing the microbiome. I also like to use it in my liver gallbladder flushes. And that's one of my favorite ways to use it is once we flush out the liver gallbladder and all of the congested bile comes out, some of it gets stuck in your colon, and then I send people to you after that flush to, you know, clean it out. I think that if people have, parasite infections, candida, bacterial overgrowth, SIBO, etc., it can also be very helpful because it just clears the way so that what I'm doing from a herbal point of view or a supplement point of view to heal the gut, restore the microbiome, kill parasites, kill bacteria, it really just kind of allows the system to be cleaned out so that I can do my job there. And then we do use implants, which you mentioned, and implants they can be herbal, it can be ozone, it can be hydrogen peroxide, probiotics, etc. Coffee is really stimulating a detox process. And all of those can really just accentuate a treatment plan that I'm giving my patients. So, so I love having you there. And not only that, you can also add on lymphatic drainage. So let's talk about that too.
So the lymphatic drainage basically, I don't have my chart with me, but if you were to look up the lymphatic system and you're looking at the vessels, it's similar to our circulatory system in that our lymphatic vessels are running throughout our entire body, head to toe, front and back. And the reason it's so important is because it's carrying out approximately 45% of the toxins out of our body and draining through the normal channels like our urine or through our stool or through our skin when we sweat. And I think, as you've discussed with a lot of your patients or in your Truly Transform program, making sure that those exit pathways are open is really important, which is also where the colonics comes into play. But for so many people, whether it's stress, I think is one of the biggest ones again, just poor diet, lack of movement, exercise, not doing something as simple as taking deep breaths throughout the day and drinking lots of water. When we're not doing those things or we're under a lot of stress, our lymphatic system can become stagnant and congested, and so those toxins, get stuck in different areas in our body and they're not moving and flowing and draining as they're supposed to. So what I do with the lymphatic drainage, I'm going to go ahead and show you the device here. This is called the Inspiration, and it's a special device that uses a special technology which has ozone, a special light energy, harmonic sounds, and I'm going to put it on your skin just so you can see. And hopefully this will turn on just to give everybody a quick. You might even be able to see the light and hear the sound. So what that is helping to do is using that special technology I just mentioned to go in and break up that congestion, to stimulate that flow so that the lymphatic fluid can then drain through those normal channels again. Most of the time, after a session, a client might have to urinate a little more frequently. That's just a good sign that everything is moving and draining as it should, again, through one of those main exit pathways, which is our urine. And then they might be also feeling a little more tired or just a lot more relaxed, and that's because it's putting our body, as you mentioned earlier, into that parasympathetic system where just allowing our body to heal and sometimes accessing what we can't on our own when we're not doing that deep breathing and meditation and just slowing down. So it's really important because it's optimizing our immune system by taking off that burden from the rest of our body by making sure that those toxins are really making it through those exit pathways the way that they're supposed to.
Yeah, well, I love it because when I had really severe eczema, it's like the place where I wanted to scratch so bad, and you could never reach it. And so anyone with eczema knows this, like you scratch, and it's like this itch you can never really get to. I feel like the BELD actually got to that. And that really helped me to understand that my eczema was really, my lymphatic system was just super congested. And so when I would do BELD, it would just hit that spot and it would feel so good because it would feel like it was literally an internal scratch. And then everything would move, and first my eczema would flare a little bit. Just because the toxins were all kind of being released. And then, a couple days later, it would be so much improved. So I love the lymphatic drainage for my patients when they have any skin problems like eczema. You can't necessarily, you shouldn't do it on like raw open skin, but it can be really great, even just around the eczema patches to get that lymphatic system moving. But also when people are having like joint pains, muscle aches, a lot of that also is lymphatic congestion too. And I know this to be true because when I detox my patients, they'll end up saying, oh, I have this neck pain, or I'm getting these muscle aches here, and then I'll send them to you, and you'll move that lymphatic system there, and then they'll report that it has gotten so much better.
Yeah, and again, it's just really relaxing the system. I've had several clients with chronic pain as well say that they leave feeling that they can actually feel the flow in the session, and then after really feeling a lot better as well. And as you mentioned, somebody with a lot of skin issues, eczema, acne breaking out, and this is both true for colonics and the lymphatic drainage. Again, the reason why that's effective and important is because it's relieving the body of that toxic stress that if one of those exit pathways is blocked, as you've talked about, how it's going to try to find every way to come out. And so doing either the colonics or the BELD, or both in conjunction with each other, really helps to just relieve wherever that blockage is and get things moving, whether it's in the colon and the lymphatic system. And if you're doing both together, it's such a beautiful harmony, because then you're opening up one exit pathway and really pushing and draining things toward there.
Yeah. Well, I did my first podcast, I mentioned dry brushing. And I think that's a super easy thing to do. Just buy a dry brush on Amazon, and you just brush your skin, towards your heart or even towards your joints. And that will allow that lymphatic system to also move and clean itself. And then doing hot cold showers, ending in cold, that alternation of hot cold also stimulates the lymph to move as well too. So I think that you can preventively deal with joint pain, achiness, etc. by doing those daily lymphatic things.
And even, for the clients I see who have pretty severe congestion, and I see a lot of clients post-surgery or, different procedures where you can physically feel the lumps of just the congestion in their body. I'll tell them, it's great to come see me, but in between the sessions, you really need to be doing the dry brushing and the hot cold therapy as well. And I've had several people say that when they're doing those, or rather when they're not doing it, that they can really feel the difference.
Well, lymphatics are so important. Your gut's so important. In my practice, as you keep saying, the exits are the main thing I'm looking at. And I always say your exits, number one, we identify the stressors. Number two, all your exits have to be working well. And so your kidneys, your lymphatic system, your bowel movements, you have to having daily bowel movements, urinating well, no kidney pain up here, in your back. And if you are itchy, if you have aches and pains, joint pain, etc.,
headaches,
brain fog, exactly. Your lymphatic system might also be congested. So
anxiety as well.
I mean, almost every symptom you could possibly have can be due to these exits not working and everything getting congested. So you in my practice, I mean, you're like necessary because everyone who goes through my programs needs to have these exits working. So I'm so grateful that you flipped your life upside down and decided to take a path of becoming a wellness practitioner. And so where can we find you? If we're online, can we reach out to you? Can people message you?
Sure. I'm on both Instagram and Facebook as the Colonic Counselor. And then as far as, if you're not local to us or in the area, you can also go to i-act.org to find a colonic counselor, a colon hydrotherapist near you. And for the Bio-Electric Lymphatic Drainage, inspiration.com, and again, she'll put it in the description. And then I'm also on Yelp if you're in our area at Natural Start Medicine, Colon Hydrotherapy, and Lymph Drainage.
Great. Well, I'm sure people will reach out to you and even probably ask you about your story, and just, I'm sure it's very inspirational. So thank you so much
thank you for having me.
Chatting with me today. I'm glad we finally got to do this. And for everyone else, I hope you join me next time on Getting to the Root Cause. And if you are on Instagram, make sure to follow me at drfong.nd. and on Facebook at Diane Angela Fong ND.